The following program is furnished by its producer, host, and sponsors.
Good morning, Rockland. It is so nice to be back here again today on this Labor Day weekend, the end of the summer. Hard to believe. I am here with Dr. Lee Morgentaler. Happy to have him here, and I want to acknowledge that I see a new man at the board, Will. Steve, it's my first time at the show without Steve behind the board, so good luck to you, Will, and all the things that you're going to be doing here. And, of course, Jeff is a good friend of mine. So I'm here with Dr. Lee Morgentaler. Dr. Lee Morgentaler and I know each other through playing tennis at the Nyack Field Club. We have fun out there, but, you know, in our professional world, we both help a lot of people. Dr. Morgentaler has a practice in Japan.
That's correct.
And he's here with me today to talk about his practice, to talk about some of the challenges that maybe seniors face, and, of course, the work that I do, as many of you know who have been listening to the show. My company is Emerald Medicare, and we help people all year long with making the right decisions for Medicare. And it's complicated, it's confusing, and starting October 1st, you're going to see a tremendous amount of TV ads, tremendous amount of paperwork in your mailbox, and I'm here to help. So, again, just at the beginning, emeraldmedicare.com, 845-358-1220, offices in Nyack and Stony Point. Here to help. Services are no cost, and pleased as can be to help as many people as I can. So, Doctor, thanks for being here today. It's such a pleasure to be here at the microphone with you.
Well, thank you very much, Mark. And before we even start, I just want to thank Mark Brownstein and Emerald Medicare for helping many of my patients get the proper insurance.
Well, thank you for that. And so, your background, just a little bit about that is, where you're raised, you moved, you're back you're here in Rockland, working for how long? Just a little bit of history for the people who are listening, and many of them know you. So,
all right,
reintroduce yourself.
I was pretty much born and raised in Miami, Florida, where I attended Nova Southeastern Medical College. I did my residency at Jamaica Hospital, Queens, which brought me to Manhattan, where I lived and practiced for nearly 10 years. In 2002, I moved to Rockland, whereupon, after getting tired of the long commute to Manhattan, I decided to start my own practice. In 2003, I originally rented in Blauvelt, and then in 2011, I moved my practice to Tappan, New York.
Well, that's great. So you've been in Rockland since 2003, and you would consider yourself a family practitioner, correct?
That's exactly what I am. That's my board certification.
Right. And you've actually done other trainings as your career has evolved, specialized in family care.
Family practice is its own specialty now.
Okay. And so one of the things that we had talked about is one of the reasons why you had decided to go into family practice is really because of the relationships, is the connections that you make with the people, different than some of the other doctors that are out there doing the work they do. You really enjoy that, don't you?
Well, that's exactly right, Mark. Just like you also make connections with your clients, I make long relationships with my patients. I've had some patients that have been with me since the very beginning, 18 years. And it is truly the relationships that brings the most gratification to my profession. Yeah,
it is a great joy to help the kind of people that we do who really need the help. They need to understand and educate. So you see quite a few patients per day. You're a pretty busy practice. Tell us a little bit about sort of the kinds of patients that you have and sort of the hours maybe that you keep there supporting these patients.
Well, Mark, you're absolutely correct. I am quite a busy physician. I start my day. I'll get into the office at around 8:15, and typically, even though I open up for business at 9, there's typically a wait outside, and where I'll let them in. I'll let the patients in. Thereupon, I'll get some early morning paperwork done. If I can start seeing people early for their convenience, I will. I typically have office hours that are open until around 4 or 5. And again, I may see anywhere from 20 to 30 people a day.
Well, that's a lot of people, and so again, you probably see people of all ages. Is there a larger percentage of people 50 to 60 and above, or would you say it's spread out across all age groups?
Well, it's definitely spread out across all age groups. Although I would say a minority of my patients are under age of 18. Although I do have a 16-year-old or two. But there is a plethora of pediatricians in Rockland, so they tend to get the patients under 18. I would say the majority of my patients are between the ages of 30 and 80, which is quite a wide spread. And as per health reasons, we know that as you age, you tend to have more health issues. So the majority of my I would say I say mostly 50, 60, 70 years old, but the cliche for family practice is womb to tomb, meaning I've delivered babies before. In some states, when there's not an obstetrician in every corner, the family practice doctors even do the cesarean sections. I'm trained in that, although I choose not to do that. But I see patients across all age groups, but largely adult medicine, 18. I have 90-year-olds, even a 100-year-old in my practice. Thank God that there's doctors around who can keep the seniors going and alive and well taken care of. And so, I speak of on occasion that you are old school, but you're really new school. And so one of the things that we talked about is, your belief that the way in which you deliver medicine or run your practice isn't really old school at all. It's more of the new modern approach to medicine and care. Can you just talk a little bit about that? Certainly, Mark. You may consider me to be old school in the sense that I still use paper charts. Rather than e-scribing, I still write on an old-fashioned prescription. However, I like to consider myself new school because in what's considered quote-unquote modern medicine in your big conglomerates, the patient tends just to be a number. They go from specialist to specialist. Nobody seems to know their name. In my practice, I know everybody's name. I know their families. I know their children. I know their hobbies. I know their sports teams. And even though that may be considered what an old school physician was back in the 1950s, we've kind of lost that way. And I guess whatever's old is new again.
Well, that's great. I think that, the paper charts aside, I think that, one of the things that you do and you regularly connect with your people is you're regularly staying up to date with journals. You're keeping up to date with what's current, what's important. And so talk a little bit about that, because I think that, we all want our doctors to be up with the latest information because there's always new research.
Well, Mark, just like you, always staying up to date with new Medicare Advantage plans. I have to stay up to date with new treatment plans and treatment options. I read at least 2 to 3 journals a week. The premier journals on the planet are Lancet from Britain, the New England Journal of Medicine, and the Journal of the American Medical Association. I routinely read those journals on a weekly basis. There are a couple of fringe journals that I may take a look at, but those 3 are considered the gold standard for medical journals. And in order to be a good physician, you must, and I will repeat the word, must stay current.
Well, Dr. Lee Morgentaler, you are a professional. You are a unique doctor from the world that I'm experienced and have enjoyed getting to know you and being across the net playing ball with you. One of the things that I know in the Medicare world is that insurance companies, handle things in their own unique way. Insurance companies are an important part of people's care because they are concerned about what's covered, what their copays are, and how much ultimately they're going to have to pay for the services that are rendered. How much of that is a part of the conversations you have with them, and or do you see a real connect or disconnect with people's understanding of the services and the costs associated with the care they get?
Well, I think to start with, I have to say that the biggest obstacle to good health care right now is insurance companies. I also have to say that most patients have no idea how their insurance companies work, and that can be a problem. And Mark, like I'm sure you educate your clients, I try to educate my patients.
That was a very, very politically correct answer. So I give you credit for that. Yes, the insurance companies are in control of a lot, and certainly I speak to a lot of clients about self-advocacy. Is, whether they're calling the insurance company themselves or they're calling us to see if we can intervene. Those things are important, and people do appreciate when we're able to do that. When it comes to the 5 things or so that are a challenge for Americans, the impairments, the issues that people face, what are some of those things that we all probably know, but I just want to hear you reiterate it, that are the issues, the diseases that you typically see, and maybe some comments about them?
Well, in all fairness, I think that Americans themselves are the biggest problem for, I don't know if anyone's been to the mall lately, but obesity is running rampant. If people would take care of themselves when they're younger, we wouldn't see diabetes, hypertension, heart disease, cancers when they get older.
So are people heeding your advice when you make suggestions on things that they can do to improve their health?
Well, let's say there's a psychological and verbal commitment to make changes with weight loss, exercise, and diet. Yet in actual practice, I would say sometimes I'm dissatisfied with the amount of my patients that actually put those changes into practice. But I certainly counsel everybody about proper diet, quitting cigarettes, moderation of alcohol use, and overall good, healthy living.
Well, that's I know that I get lectured by my primary care as well often. We're in the days of COVID, and we've been a year and a half into it or more, and it's been a challenge. And I guess we were just talking moments ago about that this is, an airborne disease, and, that washing the hands is important. Again, you've seen a lot. You've seen a lot of patients around COVID and their fears around COVID and vaccinations. And I know you told me that you're getting the booster because, you had gotten it back in December or January. So any comments about COVID for the audience current that you can mention?
2 words: get vaccinated.
Right. Well, that's I think that's important. But even with that said, there's still all the talk about where we're heading, right? And what kind of diseases are out there, and will maybe be out there for years to come. Any advice that you have for your patients besides getting vaccinated?
Well, I think the first thing we have to understand is that the only virus in the history of viruses that's ever been eradicated from the planet is smallpox. Otherwise, every single virus that's been on the earth since the beginning of time is still here now. So COVID will not be going away forever. It will always be on the planet. However, if we all get vaccinated, and if that means getting a yearly booster shot, which has not been CDC indicated, we don't know that yet, but if that's what it's going to take, then so be it. I encourage my patients to get flu shots. The flu typically kills anywhere from 20 to 40,000 people in this country alone per year. We already can look on the numbers, depending on where you want to look at the numbers, but you'll see that it's certainly in the hundreds of thousands who've died in the past year and a half of this COVID disaster. But certainly it's appropriate to get vaccinated. Mask mandates have been changing. In all fairness, I've started wearing my mask indoors again, even though I'm vaccinated fully and going to get my booster today. But I think the most important thing someone can do, if we have to pick all the variety of ways to avoid COVID, be it hand washing, mask wearing, social distancing, the most important is those two words: get vaccinated.
Well, I agree. So other fears that people have, what would you say is the biggest fear pre-COVID that people had who came to your office for their own future, their own health, based on themselves or their family history?
All right, pre-COVID, when people weren't worried about this devastating virus, I would say it was cancer. And that's largely been propagated by the internet in the sense that every symptom on the planet someone may have, fatigue, night sweats, weight loss, you name it, somewhere on that long list on WebMD, there'll be the word cancer. And people always seem to gravitate to that. So I would say before COVID, people were concerned about cancer. I would say that would be their most, that would be the patient's biggest concern. They would come in with some disease state or some symptomatology that they looked at on the internet, and of course their eyes immediately gravitated to the 30th diagnosis that it could be, which is cancer. So the patients that are out there who are coming to you, you've gotten to know them. They're your patients. You treat them as they get older. And for them, they are sort of trying to take care of their own health. They're also trying to not necessarily, maybe even especially during COVID, come in as often. Have you seen a transition or a evolution that people have now begun to come back to the doctor when maybe they were hesitant to even go into a doctor's office? Has that changed at all, or has it been pretty regular throughout COVID that you've been able to see patients and people who needed to see having delayed care? I would say during the actual lockdown, which was 2020, perhaps it was from March to June, if my memory serves me correctly, I saw a markedly decreased amount of patients. However, once lockdown was lifted, I've actually been busier than ever. Now, some things have been maybe put on the back burner, like colonoscopies, elective surgeries, things like that. But as far as people just taking care of their general health, hypertension, diabetes, cholesterol, those are the big three things that I treat. After lockdown ended, which was, again, somewhere around June of 2020, my patients started coming in again.
Well, I was curious about that. So, again, Mark Brownstein here with Dr. Lee Morgentaler, Emerald Medicare. We support hundreds a month. I probably speak to 1,000 people a year on the phone, and I probably do seminars or webinars to about 1,000 people a year, educating them on Medicare. I work with financial planners. I work with CPAs. I work with veterans. I work with Bridges. I work with the Alzheimer's Association. I am out there in this community really doing my best to educate people. And, in many cases, people are perfectly content with the coverage they have. And I'm happy to tell them that they are in good shape and they should just continue the course. But there are many people who are not happy with the insurance company. And my comment is 8 out of 10 people, if you ask about a particular carrier, they'll be somewhat satisfied, but you'll never get 100%. But certainly the carriers focus a lot on customer satisfaction, and they want to do everything they can for that. So, Doctor, do you see one insurance company handling claims or handling authorizations or handling their clients better than others?
No, they're all terrible.
Okay. And it's all relative. People's experiences often are dictated by the carrier that they had when they were in a company where they had group coverage. But now, for the first time, people actually have choice. And so people have to make a decision on what carrier might fit their needs best, and what their people's their friend's opinion about these particular carriers might be. So even though, I'm going to agree with you in one sense, Doctor, is that insurance companies are looking out for their own profit. There's no question.
That's true, but that being said, Emerald Medicare I found to be one of the more quality insurance plans.
Well, Emerald Medicare is not an insurance plan. Emerald Medicare is just simply a consulting company that helps. But thank you for that. People, because there's Empire and there's Emblem, people often get confused about that. So that's great. So again, back to the insurance companies for a moment. They are necessarily evil. We don't have nationalized health care here. Right, and so we talked a little bit earlier about that model, and doctors are joining other larger firms so that they are protected. They have their E&O coverage through them. They don't have to deal with the administrative work that you do, and so you've put yourself in a position where this is the way you want to run your practice.
That's correct, but I will say it's getting harder and harder.
Yeah. Elaborate a little bit more on that.
All right. The administrative burden is what's getting harder and harder. Lately, there seems to have been a trend on data collection, so I find myself that I had to hire an extra staff member just to fax charts out to insurance companies. For whatever reason, they're collecting information on everybody, and that's become a burden. Prior authorizations for medications, CAT scans, MRIs have become so burdensome, I try to avoid them at all costs. It's the administrative burden spurred upon by restrictive insurance companies that are making my job the most difficult.
Well, it is true, and we talked earlier again about the advocacy, right? So we encourage our clients to call us so we can help them escalate a situation. It's a lot of work. It's a lot of work. Very few people actually are in a position where they want to advocate for themselves, let alone deal with any kind of a denial and appeal process. It's a lot of work, and it's actually, my information is that appeals are successful. It's just a matter of how much time it takes to actually get to that point where you're willing to do it, or how you get the help to do that, and how do you get coached to do that so that you get paid for or have a bill go away.
Well, what I think that is, if someone is smart enough to have Emerald Medicare working behind them as their friend and support group, they will certainly have a much easier time with some prior authorizations and appeals processes.
Right, some. There's no question. So for the people listening here today, in terms of advice you may give them in terms of health and care and regularity of seeing a doctor, how to take care of themselves better, what advice would you generally give that I'm sure you give all the time, every day?
The most important thing I can tell you to do is take care of yourself when you're younger. It'll certainly come back to haunt you when you're older. That's the most important advice. Don't wait till you get sick. Keep exercise when you're in your 30s. Don't smoke cigarettes. Don't drink too much.
Right. And so the millennials that you see, speaking of that, you had mentioned to me that when you're seeing them, they're in there. They have a kind of a different attitude about care.
Well, as we all know, the millennials feel like they're entitled to everything. So why not good health care also?
Well, you had also mentioned that they have sort of a proactive attitude. And so they're really more maybe interested in looking at their own care going forward.
Well, they're proactive in the sense that I like to say that they think they have they have an MD from Google. So that's how they're proactive. They don't know what they don't know.
Well, Dr. Lee Morgentaler is here with me today. Mark Brownstein from Emerald Medicare. We are just a little less than a month away from the beginning of open enrollment. Starting October 1st is when the new plans for 2022 are revealed, which means that I can talk about the new plans for 2022. I can tell you that I can't help someone with a new plan until October 15th, but October 1st all of a sudden I can talk about it. And I've seen some first looks, and the one thing that I'm going to say that I'm pleased about, and in the years I've been in this business, I've continued to hope that they would improve, is the dental, the vision, and the hearing. And so those carriers that are in this county, and I would say across the country, have really upped the ante in terms of the dental, the vision, and the hearing. It's not perfect. You're not going to get paid, reimbursed, or go to your loyal dentist, but the options are there, more than they were in 21 and more than they were in 2020. The government is looking at this issue. Dental is important. People's eyes and teeth and hearing are all important when it comes to care. Original Medicare does not cover any of those three things, but these Advantage plans, which I think Doctor and I would say are certainly something to look at, but not for everyone. But everyone has to look at these Medicare plans when it comes to their health and their budget, how much they travel, what it is that's important to them, and make the decision. Couple of parting comments from me, and then I'm going to have some parting comments from our doctor, is that one of the reasons why New York is such a great place for me to do business is that each and every year people can change their plans without any health questions, without any underwriting, without any pre-existing conditions. You can move from an Advantage plan to a supplemental plan and vice versa every single year without any questions being asked. That is only the case in 4 states in this country: New York, Connecticut, Massachusetts, and Maine. And so for the folks in New Jersey and clear across the country, switching from an Advantage plan to a supplemental plan or vice versa often requires underwriting. So those are my parting comments. Dr. Lee Morgentaler, parting comments for our great audience here.
My parting comments are: get your exercise, eat healthy, don't smoke cigarettes, get vaccinated, and when it's time for you to get your Medicare, I would recommend calling Mark Brownstein and Emerald Medicare.
Thank you so much, Doctor. Thank you, WCR listeners. I will see you next month, first Friday of October. Thank you very much. Have a great weekend.
With local news, local traffic, and local weather, if you like local, you'll love AM 1700 WRCR and WRCR.com.